I'm Dr. Tony Tan. I'm obstetrician and gynecologist. I've been a doctor since 1993, so it's been 27 years now. Yeah. It's my wife, Dr. Pei.
I'm Dr. Pei. I'm an anesthetist, and we're actually classmates in medical school. So yes, the number of years of experience will be the same. And yes, we have 2 kids, and they are aged 22 and 19. What I admire most about him will be his dedication to his work, and he is so dedicated that he will keep abreast with all the latest, and he keep up with it and read about it, and make sure that he implement it in his clinic and get his nurses to execute them. So there are 2 big categories: those that involves medication and those that do not. So the common medications that are used in labor ward will be things like Antonox gas, the Petadine injection, as well as epidural injection. So Antonox gas is used, delivered via a mask from a ward source with pipeline supply, and it comprises of laughing gas, which is nitrous oxide, as well as oxygen. So it's a mild analgesia, so it is very effective for like mild pain. But when it comes to severe pain, Antonox gas is actually not that effective. And very often, some of the women may opt to convert to epidural analgesia at that point in time. Then again, for Petadine injection, it is also effective mainly for the mild to moderate pain in labor. And it generally lasts about 2 to 4 hours, so not very long. So throughout your whole labor, you perhaps may only receive like 1 dose, because very often we avoid giving Petadine when the delivery is expected in the next 4 hours, because of the fact that Petadine crosses the placenta. It goes from the mom to the baby through the placenta, and when the baby is out within that 4-hour period, sometimes the breathing will be affected. It slows the breathing, and then the neonatologist may have to end up giving them supplemental oxygen as well as naloxone,
Which is the antidote for Petadine.
Which is the antidote for Petadine, which is to reverse the effect of Petadine so that the breathing picks up again. And then epidural analgesia is probably the most effective form of analgesia that we have and right now. And it is administered by an anesthetist, a trained anesthetist, and it involves leaving an epidural catheter in the back. And through this catheter, we administer medications, and this medication can be adjusted, the concentration can be adjusted, the infusion rate can be adjusted, such that even if you have the epidural early on in labor, as the labor progresses and more is required, you can step up, and that can last till baby is out. And even if an emergency cesarean section is required, then more medications can be given through the epidural catheter. And it can be used for the cesarean section as well. Oh yeah, of course, there are contraindications to having an epidural, and that will be definitely like patients who are on blood thinning medications. Okay, like patients on Clexane, blood thinner, that can be given for their antenatal problems. And that would have to be stopped maybe like at least a day before the actual epidural injection. So if it's not stopped in time, then there's a risk of a blood clot forming in the spinal cord, and that can cause paralysis. So yeah, that is the main contraindication. And of course, the other contraindication would be any lesion in the brain that causes the pressure to rise. So should there be an epidural injection, and should there be an accidental, what we call a dural puncture, and then there's a CSF leak, and then the patients can actually go into like what we call coning, and they can go into a coma state. So that is not safe. Yeah, these are the 2 main contraindications. The rest, sometimes patients complain of like backache and all that. All these are relative contraindications to having an epidural. That may state, it can still be done, if the patient chooses to.
Well, I guess our patients come in 2. types. One says, give me the epidural. Another one says they try not to have the epidural and they want to use all other methods before they touch the epidural. And then we have to tell them that there could be other methods involved, and that could be non-medications or with the use of medications including gas and air and this betadine. The non-medical methods include things like some people are trying hypnobirthing. So they go for hypnobirthing classes where somebody who is good with hypnotherapy will then teach them how to breathe, how to distract themselves. Of course, some people put on the music hoping that this distracts them. Some people like to immerse themselves in a water tub with with body temperature water, and sometimes immersion in that kind of environment already soothes their pain and reduces the pain. And some people actually prefer to deliver in the water as well, water birth. Yeah. So I guess those are few and far in between. And well, whether it succeeds or not really depends on how well the patients are prepared. If they had gone for classes regularly and they are good at meditation or mindfulness or this distraction, then very often we find that it actually works out for them. However, if they have gone for 1 or 2 theoretical class and they don't do it regularly, then in the height of the pain, very often you find that it doesn't really work. And so I guess in our patient population, we find that maybe half of them actually can go through without the use of epidural, and actually the other half find that at the end of trying, they still are in so much pain, they still opt for an epidural. Yeah. So I always tell them that whether or not you want an epidural at the beginning, read up about it, because when you are in the height of your pain and you ask for an epidural, you'll be just signing your name. And you will not know much about it. So read up about it when you are not in pain.
Actually, no big studies that have proven this. And I often tell the women whom I administer epidural for that backache can be so multifactorial. I mean, she could have pre-existing backache already because of background problem of slip disc or other back strain or anything. And during pregnancy, there's a lot of changes. The hormone changes, relaxes the ligaments because the body is preparing for childbirth, so that the pelvic cavity can increase in size so that the baby's head can descend. So as a result, there's less support for the back as well, the back ligaments as well. And then carrying a big tummy in front doesn't help, the weight in front, and then it is it's heavy. And then the childbirth itself, being in that legs up position during childbirth, all these and pushing for that maybe 1 hour, 2 hours in that position can cause backache as well. And even after delivery, all these changes in pregnancy takes about 6 to 8 weeks to go back to normal. So even the back support takes a bit of time to come back. And yet, caring for the baby, breastfeeding, and all these also aggravate backache. Yeah. So back care after postnatally is actually very important to prevent backache. Yeah.
I think there was a study where they looked at patients who had who went for vaginal birth. One group had epidural and the other group didn't have epidural. And when they asked them 3 months after the delivery, how many proportion in each group had backache, it was the same in both groups. So what it means is that backache after vaginal delivery is quite common, and epidural actually does not increase the risk of backache. The problem is if you have backache and you had an epidural, you sometimes blame the epidural for it. Whereas if you had a vaginal birth without epidural, you wonder where the pain comes from.
It's like having an injection on the hand. It's like if you have an injection on the hand, the pain here will last maybe a couple of days, the discomfort and all that. It's very much the same at the back too. But what I didn't like about epidural is the fact that you cannot feel your legs. In those days, I had the old local anesthetic medications, which is Marcaine, so it makes your legs really, really dead. But nowadays, with the new medication, which is ropivacaine, actually you can move your legs a bit more, so it's the numbness that you feel. But I didn't like the numb feeling, and I didn't like the fact that I cannot move my legs because I cannot control the lower part of the body. So that I didn't like. Yeah.